Have you, a friend or family member, ever experienced a visual hallucination? And you're not sure if you're going crazy? Well, it's very possible that you have something called Charles Bonnet Syndrome, or CBS. I'm Dr. John Michaelos with St. Michael's Eye and Laser, and here to talk to you today about CBS, or Charles Bonnet Syndrome. It's not an infrequent condition, and I actually have quite a few patients that have problems with formed visual hallucinations. It's not a psychotic episode, and you're not going crazy. Oftentimes, patients just need encouragement and support or some tricks to make the visual hallucinations go away or not last as long when they do occur. I've had patients tell me that they would see somebody standing off in the room and they stand there the entire time. I even had one lady that whenever she looked in the mirror, she would see a pineapple on the top of her head. Looked like something you'd see out of the produce section of the grocery store. It's important to know that you're not going crazy. Supporting the patients, letting them know that this is actually a real phenomenon that can occur and usually happens in patients that have poor visual abilities. Sometimes it even happens when you're fatigued or tired, so getting some rest can make that go away. In patients where the vision can't be improved, like severe cases with macular degeneration or diabetic retinopathy, in those cases, we can actually have patients either stare at the image, confront it, and a lot of times it extinguishes, or look away from it, even close their eyes, blink a couple times, and often that will make the image go away. There are some extreme cases, though, where the image can be frightening or disturbing, and in those settings, talk to your healthcare provider. Sometimes medications can be helpful in making those either not happen or become less frequent. Patients suffering from Charles Bonnet Syndrome differ from those that are having psychotic episodes in that they're a visual hallucination only, whereas somebody that has a need for help from a psychiatric standpoint, those patients traditionally believe that the visual hallucination is real. They also will have associated symptoms as well, where they can smell, believe they can touch, or even feel like the person is talking with them. Whereas patients with Charles Bonnet Syndrome simply just see the image. There are two types of visual hallucinations, and it's important to make those distinctions. One is simply a visual disturbance that's from the brain, not the eyes. The second is usually from a psychiatric disorder. To differentiate the two, Charles Bonnet Syndrome is a visual hallucination only, whereas the second type is a psychotic visual hallucination. And usually those are associated not just with an image, but the person will often feel the image is speaking with them. They can smell things or even touch and feel the image that's there.